Hello, yeah, it's Dr. Latuno again, and today we're going to be talking about diverticulitis. So, what is diverticulitis? Mainly acute diverticulitis. It is infection or inflammation of a colonic diverticula, most common course on the left side of the colon, but the right side can also be affected. As you can see from the diagram, a diverticula is an outpouching, a small pocket outpouching of the colon. The most common symptoms, of course, is left lower quadrant pain or pain on the left side of the colon. You can have a fever. You can develop nausea or vomiting, and sometimes constipation and diarrhea. Occasionally, you'll have a rectal bleeding. So when you have all these symptoms, you better see your doctors right away in order to be treated. What are the causes and risk factors for diverticulitis? Of course, it's a poor diet, low in fiber diet, which is common here in the Western world. And then chronic constipation. Sometimes it runs in the family, or you have gallbladder disease, or overweight or obese. Diagnosis includes doing a blood test. It includes CBC and complete metabolic panel. For the CBC, we're looking for signs of infection, of course, an elevated white count pertaining to sepsis. And then the most common test we use here is CT scan of the abdomen pelvis, which will definitely tell you if you have inflammation of the colon or its complication. Eventually, the GI doctor will recommend colonoscopy once you're stable and once the infection has resolved. Complication of the acute diverticulitis include, of course, GI bleeding, intestinal obstruction. Intestinal obstruction is usually from scarring, causing narrowing of your colon, and therefore causing the obstruction. And then fistula formation, abscess or abscesses, and perforation. Perforation could either be frank perforation or micro perforation. The fistula are actually once an inflamed or eroded colon once eroded, might fuse to another body of canals such as your small intestine, bladder, or vagina, creating an inappropriate tunnel between the two. Treatment includes outpatient, inpatient, or surgery. Outpatient for mild acute diverticulitis, we usually start with oral antibiotics like augmentin or a combination of levaquin and flagyl, usually for 10 to 14 days. And then you should be on a liquid diet, and you can take Tylenol or acetaminophen for pain. And then for inpatient, for severe type of diverticulitis, which includes we start you on IV fluids and IV antibiotics, usually the antibiotics we use are Socin or either cefepime plus flagyl. And then we only do blood transfusion if you're actively bleeding or if your hemoglobin is 7 or below. And then, of course, we give you pain medication, IV pain medication usually, and then endoscopic procedure if your symptoms doesn't get better and you're having symptoms of bowel obstruction. And then surgery if you develop complications like bowel obstruction, stricture, or large abscesses that despite being drained by IR still recurrent, or if you have frank perforation. So surgeon usually recommend bowel resection with end-to-end anastomosis or bowel resection with colostomy. Prevention, usually we encourage people to eat high fiber diet, drink plenty of fluids, and then regular exercise. And regular follow-up with your PCP. All right. Again, this is the end of the topic. Thank you very much for watching my vlog again, and thank you to all my subscribers. Don't forget to subscribe and like and share. Again, this is Dr. Dennis Latuno saying goodbye and see you later again. Bye.